I'm Rebecca Pierce, the mother of a now 11-year-old daughter who was born extremely preterm. I'm also part of the interdisciplinary team of the Parents' Voice Project. From a parental perspective, this project is incredibly beneficial. Outcomes of extremely preterm birth reflect what researchers have decided are important and are not necessarily what parents consider to be meaningful. Clinicians see preterm children infrequently and use standardized assessments to determine outcomes. However, parents live with their children every day. This means that they have a deeper, more relevant understanding of their children, their strengths and weaknesses, and their daily functionality. It's about time that parents' perspectives and voices are finally included in this research.
Hello, I am Ann Sinnott, lead investigator on the Parent-EPIQ study. And on behalf of my co-investigators, parents, and our participating networks, we're happy to give you an update today. Our study has 3 aims: to define outcomes that are meaningful to parents, to implement Parent-EPIQ to improve cognitive and language abilities, and then evaluate the outcomes. In aim 1, parents told us that they do not classify their children's level of impairment in the same way as healthcare professionals do. In another survey, they told us that we need to provide a more balanced view of the strengths and not just the deficits of children born preterm. In a survey using clinical vignettes, we learned from our parent respondents that cerebral palsy, developmental delays, hearing loss, and blindness are not equivalent, and that there are other health outcomes that are also important for us to report on. Delayed language occurs in about a third of babies born very preterm, and so we want to try to improve language. We have been doing this at 11 sites using a technique called EPIQ, which is a proven method. It uses evidence, local teams, and known quality improvement techniques. One site partnered with the public library to be able to give out books and incorporate that into the healthcare visit to improve language. In our last aim, over the last 3 years, we have created annual reports that are available online, and we have seen that in some areas there is no improvement over time, but we have seen hopeful trends when it comes to falling rates of cerebral palsy, hearing loss, and visual impairment. We look forward to taking any of your questions. Thank you.